Good evening, everyone. Thank you for joining us tonight. I'm so excited for us to have our April webinar. It's the end of April, but it's still Minority Health Month. So we're acknowledging that month. And tonight's discussion is going to be centered around diabetes in the community. And we live in the Black community. Okay, so that's definitely some demographics there that we can speak to. Tonight, I just want to open up in prayer, and then we'll begin our discussion. Amen. Father God, we give you thanks and praise for an opportunity to share tonight, to have a discussion that would not only be a blessing for healing to your people, to those who join on the lives tonight. We pray, Lord God, you would guide this discussion. Lord, you would help our minds to ask the right questions, to get insight, clarity, and direction that would be a help, a blessing, an encouragement, and a guide for those who sincerely need the assistance. We pray, God, you just give us the right words and grant us all understanding. In Jesus' name we pray. Amen and amen. All right. So welcome, everyone. My name is Rishona Haynes Omoyupo. I am the founder of a new startup company called Made Whole, and it is a care management company where we work with physicians to ensure that you get the care that you need, you stay connected to your resources, and have some support in your health journey. We also have our baby of the company, which is called Sparrow Medical Missions, and both companies are faith-based. But Sparrow Medical Missions, the heart of that is to support elderly individuals in the community and to provide some resources to them and their loved ones in order for them to have a great quality of health and a quality of life, and just to give honor to our elders. So one of our coaches that works with us at Made Whole and Sparrow Medical Missions is the nurse practitioner, Stephanie Jackson, who's with us tonight on the webinar. She is a family nurse practitioner as well as a psychiatric mental health nurse practitioner. And she's going to be having a discussion with us tonight on managing diabetes, chronic illness in the community, meaning how do I take care of myself every day at home, right? And we'll talk about what it looks like to take care of yourself, especially after, for example, a hospital visit that's related to diabetes admission. So I want to introduce Stephanie tonight. And Steph, if you'd like to introduce yourself and give a little bit of your background, that would be great.
Hi, everyone. Hope you're all having a good evening. My name is Stephanie. I am a family nurse practitioner and a psychiatric mental health nurse practitioner. I've been board certified for a total of, wow, 5 years. Yeah, 5 years, going on six. And I've, over the years, glory to God, Him alone, I've learned a lot. I've seen a lot, when it comes from diabetes, high blood pressure, weight loss, mental health. So, I've been in different specialties and experience, and I'm happy to be able to experience these different specialties so that I can actually give back and help others. So that's about me.
Beautiful. Thank you so much. And for those that didn't know, Stephanie's also one of my best friends. So this is an awesome full circle moment in life, and I appreciate you being able to come on tonight. Okay, so again, this is a Q&A discussion. So if you have any questions that you'd like for us to address, I think now would be a good time to just put them in the comments, and then we'll be able to address them either along the way or towards the end. We do set aside a 15 minutes towards the end of the Q&A discussion to actually address the questions in the comments, but if it fits and we can fit it in before, that'll be great. So please feel free to put your questions in the chat box. All right. So diabetes, right? This is a disorder of the pancreas. And so many people live with this disorder, if not something similar, which could be insulin dependence, right? And so it's a dysfunction of the pancreas, but we're going to get into a little more in depth on this disorder. But before we even touch on that, I actually forgot to mention, Stephanie, that you also have a company called Your Health and Wellness, where you help individuals. And so can you just speak quickly on what you do at Your Health and Wellness?
Yes. So your health and wellness was founded in 2020. At the time, I was just trying to figure out what would be my specialty. I always wanted to do like wellness services. That's why it's called your health and wellness. So, by the time the Lord has allowed me to pivot and focus on weight loss. So, with your health and wellness, that's where I specialize in weight loss services, body contouring services, as well as, and I also have my mental health consult area where I am still able to mentally consult you if you need it and start you on treatment if you meet the requirement. When it comes to the services I provide with your health and wellness, we offer a weight loss medications, better known as GLP-1s, which helps to regulate your appetite, help you to reduce your sugar levels, and in return, you are losing weight. I have patients that are losing like 15 pounds, 20 pounds in 1 month. It's amazing. It's a blessing. Their A1Cs are going down. When they go back to the doctor, their cholesterol levels are looking better. So it brings me great joy to see that happening and their confidence is coming back as well.
Mhm, mhm, mhm. And the reason why I love that so much is because people hear, weight loss, we know Ozempic and everyone's joking about it. But the reality is that diabetes, and first of all, people gain weight for a lot of different reasons. Many of them are health related. And I love the combination that you're working with, which is not only helping people physically, but in the mental health arena, because oftentimes if you don't feel great, you don't express yourself in a way it's not that easy for you to just go take a walk. It's not that easy for you to go exercise. So it's combining taking care of the physical body and getting you to a place where mentally you do feel clearer. If your blood sugar is high, your A1C is high, one of the things that might manifest is that foggy brain, um, constantly thinking about food, constantly hungry, right? You're not able to focus. And so I think it's great what you're doing, and I can see that some people are definitely successful. So let's just jump straight into the diabetes discussion, right? Um, so I actually wanted to throw out estimated 347 million people worldwide have diabetes. Okay. That's a big number. And it's a significant contributor to mortality, meaning death. And not only that, but healthcare costs. And part of the reason we're having these discussions is so that we can manage what we're going through, manage these disorders, and prevent us from having these hospital episodes and complications, right? So can you give us a little bit of insight, Stephanie, into diabetes? What is it? How does somebody know if they're diabetic?
Okay, so I like to put in layman terms and speak very direct so they understand me. All the patients like to say, well, okay, what is it? So diabetes is a no, seriously, where your body has trouble controlling the amount of sugar, which we also like to call glucose, that's in your blood. So normally our bodies have a hormone called insulin, which helps to move the sugar from your blood into your cells, where then it's used for like energy. However, in diabetes, your body does not make enough insulin or your body cannot use it properly. So the sugar stays in your blood instead of going into your cells. So just like Rishona said, the pancreas is having some dysfunction. There are two types of diabetes, by the way. There's type 1 where you will find people are born with it. They find out that they have this when they're very young. They're not even 18 years old. Usually that's when your body does not make insulin. So you have to take insulin every day. And then there is a type 2 diabetes, which is when your body makes insulin, but it doesn't work well, which is the most common type. Um, so how do you know you have diabetes? When you go for your regular workup with your doctor, they take a test called hemoglobin A1C. That test is used to assess like your sugar level over the past 3 months. So the day you go, the 3 months prior, it's checking your sugar levels. Basically, it's just like doing an assessment on you without you even knowing. How is that possible? Technology. So that test determines if you're diabetic because it looks over the past 3 months what your sugar levels have been. It's like taking an average, and then if you come out with an A1C of 6.5 or more, you are then diagnosed officially with diabetes.
Thanks for that clarity. And I know some people actually start out when they go to the doctor, they hear this term pre-diabetes, right?
Yes.
And people get really worried about that. So can you actually speak a little bit to what does that mean when I hear I'm pre-diabetic? Should I be concerned?
Okay. Yeah, you should be concerned. You shouldn't be crying and worried and thinking you have diabetes, but you should be concerned because what happens is that's when basically that's the range of where your A1C is not in a healthy range, but it's also not in a range enough where we should diagnose you with diabetes. So that's like on most lab tests is 5.6, 5.7 and up before you get to 6.5. So if you're in that range, it's like the body warning you, hello, 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 stop, cut out the sugar,
Mhm,
cut out the soda, cut out the
mhm,
juice, cut out the late
mhm.
night snacking, lose some weight. That's gonna help you. So that's the
Yeah.
body just like pre-diabetes is like a pre-warning of what can happen if you don't take precaution. Right.
hmm Good point you just mentioned there too, because type 1 is unreversible. There's nothing
Yeah,
you can do about type 1. Most people in type 1 are on medication for the rest of their life, meaning they have to take insulin to replace what they're not producing in their bodies, right?
correct.
And so, sorry about that, guys.
That's okay.
And so for people with type 2 diabetes now, and we just discussed being pre-diabetic, does that mean that, like you mentioned, changing your diet, reducing sugar, exercising can now reverse what's going on in the body? Can we speak to the fact that if you are told by your doctor that you are pre-diabetic, there's hope for you? And speak a little bit more on the interventions that you just mentioned, because that's the moment to grab a hold and take control of your health.
Yeah, there's definitely hope for you. I've had diabetics also who are type 2 that it reversed. A lot of them went into herbal direction. Some of them did like black seed oil, the bitters, the sour sops. The again, cutting out excess sugar in your diet is very important. So if you like a whole bunch of sugar in your peppermint tea, you probably want to go with honey, or you probably want to go with brown sugar, and you probably want to go with decreasing the amount that you're putting in. I feel like life is all about balance, where you really have to decrease, and sometimes you may just have to cut it all off, like the Bible says. If it's the right hand, and cut it off. Sometimes you got to cut off sugar for a while. Cut it off until you get your body stabilized where it needs to be. Exercising can be 30 minutes 3 times a week, walking.
Mm,
On treadmill. Doesn't have to be crazy. It doesn't have to be something where it's like, oh my God, these exercises are ridiculous. I can't do it. No, sometimes it's just taking a walk in your neighborhood, going around the
mm,
block at least 5 to 6 times, 3 times a week.
yeah.
Losing weight is so important. So you want a low carb diet. So I mean, if you find yourself having mainly starchy food like rice and bread and a whole bunch of cheese and a whole bunch of junk food, you want to cut that out. You want to eat in smaller portions. We like to
Mm,
say, like, there's this my meals that they have for diabetics. You want to generalize having more fruits and vegetables. A protein like a chicken, a baked chicken instead of fried chicken, is good for you. And if you want to do rice, brown rice, or if it's white rice, you want to do 1 cup. Don't try to excessively put on
mm,
more, even though I know we like our food, we're in the Caribbean, but your health is so much more important.
yeah, yeah. A lot of things you just said that are super important. I think one thing to always point out, we have these discussions because they're important and there's going to be a lot of data, but I think it's important to incorporate all aspects of the human being because it's not an isolated process. And like we mentioned before, I believe in the previous live that we did on prioritizing nutrition, one thing that came up was your mental health. And the fact that I know for a fact that many people emotionally eat, right? They've heard this a million times before. Cut out the rice, cut out the sugars. But as nurses as well, we've seen how people are addicted to food. They don't even see how they lack the ability to say no, right? So I think one of the things that can help you come to the awareness, yes, the doctor said you're pre-diabetic. Yes, he told you to change the way you're eating, but have you done it? And why not? Start to ask yourself, okay, what are the barriers to me doing what I have to do? Because you can have all the knowledge in the world, but if you don't actually begin to implement changes in your diet and in your lifestyle, there's something called a sedentary lifestyle. A sedentary lifestyle predisposes or increases your risk to so many complications. I want to point out that a lot of these disorders, like diabetes, in the long term, there are so many complications. It may not seem like a big deal today, but there are so many long-term complications. And diabetes, in fact, impacts all of your organs and ultimately can impact your heart as well, right? So some of the long-term complications of diabetes are heart disease, stroke, high blood pressure, blindness, because those sugar molecules are larger than the vessels in your eyes. So you can actually cause damage to your eyes and your vision. So some of you might be experiencing blurry vision and you don't know why. This might be one of those reasons. Diabetes reduces your ability to heal. So if your sugar is consistently high, right, you're impairing your body's ability to heal the average cut. And then that can now develop into something called chronic ulcers, right? You have these breakdowns in your skin that are unable to heal. Another, which is gonna, for some people, has developed into amputations, right? I'm smiling, but it's not funny. It's actually really, it's debilitating. It can become a very debilitating disease, right? Erectile dysfunction for our gentlemen, kidney disease, so many issues that arise from dealing with diabetes in the long term. So I wanted to point out something we mentioned again on the last slide, create a food diary. It starts, all of these issues starts with becoming aware of, okay, what are the patterns and the lifestyle changes I personally need to make. So in order to know that, you need to become aware of self. Keep a food diary. How many times did you eat for the day? How much sugar did you put in your, how many cups of rice or how many plates of rice? Us Caribbean people love a rice and a stew and a meat, no vegetables, right? How many plates of food did you eat? How late did you eat? And then I would say take that list to your primary care and talk about what adjustments can be made. Stephanie made a great point. Rice is a big one in the Africa in the Caribbean community, and so I think as well as in the African American community. What are some replacements for rice? What you mentioned, brown rice is a great replacement, as well as a lot of people don't know putting your white rice in the fridge overnight actually changes the composure of the rice and causes the sugar to break down in a different way the following day. So it doesn't give you this fast insulin spike. It doesn't give you this sugar rush. Your body doesn't have to generate all of this insulin in this moment, but it's a slower process, which is great. You want to avoid insulin spikes because your sugar goes up quickly, and then what's going to happen? It crashes. So then you have this, I'm hungry, after you just had so much food or had something high in sugar. So it's a vicious cycle of up and down. So putting your white rice in the fridge, as well as sometimes switching rice. Basmati rice is actually great for people with insulin resistance as opposed to the usual parboiled rice. So those are just like some random facts that I've learned that I wanted to put out there. So my next question for you, Stephanie, is actually, can you talk about what you've noticed about your patients, individuals in the community, and their management of diabetes? And are there any gaps, any glaring issues that we should know?
Yeah. So some of the patients that I have encountered in the past, they definitely had some gaps of care, just like not having continuation of care, not really even really realizing the dangers and the consequences of not being compliant with medication, not being compliant with therapy or their follow-ups, which is important because we need to monitor your A1C. We need to see that the medication is actually helping you, because if it's not, we need to alter the regimen, right? And so you'll have patients that are not compliant at times. I've seen that as an issue. And I think sometimes the reason why someone may not be compliant is due to lack of being educated on what is really happening, lack of access of care. Sometimes people are going like months to get an appointment to actually see a provider. And so, sometimes when they come to me, it's like I can't get in contact with my primary care doctor. Like I haven't been able to make an appointment. It's been this long, or an endocrinologist, who is actually more specialized in treating diabetes for those cases that are a lot more severe. Those sometimes takes months as well to actually find somebody, yet alone insurance is an issue. So, factors of insurance, lack of access to care, not fully being educated on what's going on, what they're taking, why they're taking it, has
Mhm,
been a common trend in the patient population.
mhm, mhm. So what are some suggestions that you would make? I work in care management currently for insurance companies and have worked for insurance companies. And I can see that, I mean, I don't know if it's by choice or by regulation, but these companies, they do desire to have healthcare individuals be able to guide patients in the community. So for example, patients with Medicaid, those are individuals who have like financial issues and so they qualify for Medicaid, or children who are orphaned, etc. There's certain qualifications for Medicaid. They would have access to care management services through their insurance. Many people don't know that. So some people are dodging calls from their insurance company when money from the state means they have to make sure that you are connected to care, right? And so they're audited annually for the way that they're providing these services. So one thing I would suggest is reach out to your insurance company, find out, is there a care management department? If you have, especially if you have Medicaid, I can't speak to the other insurance companies. But find out, do I have a care manager? And how can I be connected to that care manager? Right? Because that person will help you do some of the heavy lifting. The reality is life is busy. We live in a very busy state. Everyone's go, go, go. So sometimes what we see as non-compliance really is, I'll take care of it eventually, right? But this is the reality is we must prioritize our health. We must ensure that we are seeing our primary care physician at least every 6 months. And that's, again, I understand the barrier of not having insurance. So we'll talk about not having insurance because that's a big one for individuals. But for those who do have insurance, make those appointments top of the year, make those appointments top of the month. But if you have those moments of clarity, especially on the weekends, that's the time to make sure you're scheduling those appointments and you're making sure come hell or high water, you're there. If you have questions for your doctor, write them down before you get to your appointment so that you don't forget anything, right? And you're able to ask all the right questions. And I would even say if you're looking for, if you don't have a primary care physician, get one. That's a doctor that can address the general health needs. And as issues arise, they can refer you out. And if you do have, depending on your insurance, you may not even need a referral to see specialists, right? And then the next thing that I would say is when you go to these appointments and you ask the questions, I'm sorry, going back to selecting of a doctor, if you don't have one, ensure that, when you're reaching out, there ask certain questions about the office. You know, what's the next earliest appointment that this physician can see me? You don't just want to just take any random appointment, especially if you know that you have an urgent need, you're not feeling well, right? What's the earliest appointment? And then do you have, for example, this is 2025, a patient portal? Because yes, some doctors are very hard to reach and it can people give up when they can't reach their provider. And if you can't reach a provider and you know there's something going on, you need a second opinion. Look for another provider. Sometimes we have this misguided notion, yeah, I have a doctor, but I can't reach him, so that's it. No, you can find another provider. Your insurance has a list of people that are in network that you can work with, right? So definitely they seem so simple, but just the mental gymnastics of getting to the doctor can be a huge barrier for people. As well as something as simple as transportation. A lot of people who are on Medicaid have access to free transportation and they don't know it, right? There's a free medical, it's called medical answering service, and it's free transportation for Medicaid patients. You have some people qualify for Access-a-Ride. The social worker at your doctor's office can help you fill out the paperwork for Access-a-Ride. For transportation doesn't have to be a barrier if you have a challenge. And then as well, again, in your selection, ask, do you have telehealth visit capacity? Can I do a virtual visit with this doctor? And then there are visiting provider services in New York, one of them being SM Health. There's visiting doctors of New York. So there are a lot of resources out there that people are not aware of. So if you have questions about resources, if you find yourself dealing with a barrier, we may have some information to assist you tonight. So just put it in the comments. Let's see if we can put our brains together and be an encouragement to you. But thank you for that, Stephanie, pointing out those gaps in care in the community. Have you come across any issues with those who don't have insurance that they're able to, somehow they're still able to get their needs met? Like, what would you suggest for those who don't have insurance? That's a huge one.
Yeah, I haven't really come across, but I've had situations where I've met patients that didn't have access or just didn't have insurance for personal reasons. And there are free clinics, especially hospital based. The hospital tends to have especially like the public hospital, New York Health and Hospitals, which are in the five boroughs of New
Mhm.
York. They have these clinics, and these clinics are actually free. So, which means if you have insurance or you don't have insurance, like you can actually go there to get care. So, I like to recommend them or refer them to those
Right.
um, clinics that are free based, so that shouldn't be an issue with them being able to get access of care, getting their blood work done. And then also the hospital has social work services. So if it's being based from their clinic, they can set something up where the patient can see if they qualify for Medicaid or any other health insurance plan and move forward from there, get a social worker assigned to them that can help. But there are clinics, there are services that actually offer it for people who are, either low income or have no insurance, so there are services out there. again, one of my main go-tos, like I said, is the New York Health and Hospitals, their subdivision of their clinics.
Mhm. Okay. So let's talk about scenario now. Someone goes to the office, they're diagnosed with type 2 diabetes or type 1. They're diagnosed with diabetes. What should be their next steps? Obviously, and I forgot to mention this caveat, seek medical advice from your doctors. This discussion hopefully will answer some of your questions about diabetes management. So for the person that's newly diagnosed with diabetes, what are some of the things you think they need to know right away about managing diabetes within those first few weeks?
Yeah. So right away, they need to know why they were diagnosed. They need to know about diabetes, what it is, what it can result to. Um, they need to have their blood work done. Of course, that's already done. That's how they got diagnosed. Forward from there, a treatment plan will need to be discussed with the patient as into whether they're going to be starting on insulin or be starting on just oral medications, which is if your A1C is not above a certain level, we if it's below, I would say around 8-ish, nothing above like 8.5-ish. We will more so gear to putting you just on oral medications by itself versus just needing to put you on insulin to get that A1C dropped, quicker. Because of course the insulin will work a bit faster, as in if you have a really elevated A1C. You're people who go in there with 13, 14, believe it or not. So our first go-to usually is just oral medications. We educate you on what we're starting you on, why we're starting you on it, the side effects, what you should expect, and when to return and follow up.
Some of the
Being,
most common.
what you said? Yeah, yeah. So then we'll book a follow-up appointment with the patient. Just so on, that's just how it goes on. Consistent monitoring to see what's going on. Those quarterly are important, especially in the beginning of when you're starting care.
Yeah. So very good. So the person that is given oral medications, let's talk about that a little bit. We have the common ones, metformin, glyphosate, glucophage, and some of these medications, they have side effects that people don't like. And sometimes people stop taking the medication, they skip doses. So let's talk about taking medication, following the doctor's instructions. What are some of the side effects that people might experience with the oral medications, and how can they, for example, manage that? For example, I know with metformin, a lot of nausea, GI discomfort.
Mm-hmm. Yeah. Yeah. Most common side effects, I would say, sorry. The most common side effects I would say is you have a risk of having low blood sugar. So you would want to know what that is and have like a little candy around with you. So that could be like the shakiness, the sweating, the dizziness, hunger, confusion. So you would want to also have you, which your doctor more than likely will prescribe you like a glucometer. So you should be checking your sugar on a regular basis while you are at home as well. So if you feel like that, I would always say like have a little juice or a little candy decide to take immediately and check your sugar to make sure that you're not having any low blood sugar, also known as hypoglycemia. So, like you said, the nausea and the upset stomach, that's very, very common. Some people can actually gain weight, but also in reverse, people can lose weight, which I see very commonly, people losing weight on medications, which again, weight loss is like one of the best interventions you can use to help lower your A1C. And some people develop like skin rashes or itching. That's really about it. Like little bit skin reactions, little bit skin sensitivities, but the GI distress is very common. Weight loss is common as well, and a risk for low blood sugar. So you want to monitor it to make sure that.
Mhm. I'm glad you brought up the low blood sugar because I mean you have the I'm sorry, the range of maybe 60 to 120 being normal range for someone that is not diabetic.
Hmm.
But what are the ranges do change along the spectrum from a normal individual without diabetes to someone who's pre-diabetic, the range will change, and then to someone who else is diabetic, their normal range will change. So I don't want to throw a number out there and say, oh, your blood sugar should be between this and between that. Again, follow the instruction and the guidance of your primary care physician, and the provider will let you know this is the range of sugar that we want your sugar to be while you're taking this medication. And it's also important to know, yes, not everyone will have to check their blood sugar every day If you're newly
Mhm.
diagnosed with diabetes, the doctor will instruct, okay, you need to check your blood sugar when you wake up and before each meal.
Yeah.
Because then you will have a scale that tells you this is how much insulin you need to take to cover
Yeah.
the meal that you're about to have, right? So we shouldn't just be eating willy-nilly at that point. We should be following the physician's instructions. For oral medications, oftentimes the physician will just say, make sure that you eat this. I'm sorry, that you take this medication with the largest meal of your day, if you're taking it once a day, or with a meal, however many times the doctor instructs. And like
Mhm.
Stephanie said, look out for those symptoms of low blood sugar because sometimes you had a busy day, you're running around. Activity and exercise actually help to use the blood sugar that's in the bloodstream. So that's another great intervention for keeping your blood sugar under control is activity. And so by the time you do, you might sit down and have that one meal for the day, or not have it at all, and then have something really light. You might find you're feeling jittery, you're feeling weak, you're feeling nauseous. Those are signs your sugar is low. You need to eat something and maybe, again, speak with your physician, but maybe that's a moment where you would not take the insulin, you would not take the medication because your sugar is low, right? You're not in danger of a high sugar at that point. But
Right.
actually, able to point out, Stephanie, you mentioned being diabetic or being diagnosed with diabetes. Once that A1C is, did you say 6.5 or
Yeah,
above?
6.5 or above, yeah.
Yes. So what is the goal here, especially since diabetes for the type 1 is what do you call it? I'm sorry, non-reversible, and type 2 can be reversed depending on diet and lifestyle. So what should someone's goal be when they receive this diagnosis and they're put on medication? Some people, we're people of faith, yes, but some people say, well, God's gonna heal me, I'm not taking this, and they just don't do anything about it. And they think that they can just detox and voila. So how should someone process this information?
I feel like if your A1C is not that elevated, you want to give it a shot at detoxing, and it's not at the range of like, oh, you have diabetes. You give it a shot if you're really going to be serious and make necessary permanent lifestyle changes. I would still say heed to what your provider is saying. You discuss that with the provider first, because some patients will say, "Hey, I'm not ready. I don't want to. I'm going to incorporate some life changes. I'm come back to you in a month, or I'm going to come back to you in 2 months." And sometimes it's down. So
Yeah. Yeah,
it's
no,
down,
that's true.
right? It's down, but if you're at 6.5, it's up there, it's elevated. You're not making any necessary lifestyle changes. It's time for you to take the necessary lifestyle changes. And even if that means the doctor's putting you on like an oral medication that you're gonna take once a day, I would say abide, follow with it, do what you have to do. Um, Change your diet. Like I always said, we were speaking on the diet just a while ago. The goal for the provider is to lower that A1C. Let's get it down. So it's at 6.5. We work in increments. We know, okay, I'm not expecting you to come back to me in 3 months and your A1C is going to put you back at 5.7, which means you'll be pre diabetic. And then from pre diabetes, we're working our way down to a normal range A1C. What I'm trying to say is just like, it's gonna go down. It may take a little time, but the goal is for us, as long as it's going down and our patient is not in any harm or danger, that's that's the goal. Let's get it down. Let's get
Mhm.
that policy down. And hey, even if you come back to us in 3 months, you went from 6.5 to 6.0. That's good. We could either alter the regimen, add something to the regimen, to get it down even lower, or just continue to watch the body take its time to heal and to reverse, because you have to give your body time as well. You've been putting
Mm,
all this junk in for so long, for so many years that led to this. You have to give it time now to get that junk out.
mhm.
That's how I look at it as well.
Hmm. And while insulin is the treatment for type 1 diabetes, diet and exercise are part of the treatment plan for type 2 diabetes, along with the oral medication. And then if it advances, then yes, insulin would be added to that treatment plan. But I just wanted to put that hope out there. Diabetes is not a death sentence, it's a wake up for a lot of people that, hey, I got to make some changes yesterday, right? And so,
Exactly.
again, be realistic with yourself. If you live a sedentary lifestyle, meaning you don't exercise at all, or the most exercise you get is, walking from the train station to your house,
Hmm.
begin to think of realistic ways that you can begin to work out, whether it's some small hand weights and your body weight early in the morning before work or in the evening after work, whether it's circling the block a few times, walking before you walk into your apartment building, whether it's joining with friends in the workplace and doing a challenge. Get creative. This is your life. This is your life. And like you mentioned, Stephanie, permanent life changes, because now you know what your body's capable of if you don't make those changes. So they have to be realistic. You got to be smart goals, right? Specific, measurable, actionable. I hope I'm remembering that right. Realistic, and have a timetable. Okay, in 3 months, my doctor said it's possible my A1C can get down to 5.5. So within these 3 months, I'm being intentional, and it takes 21 days to form a habit. So by the time you do get to your doctor in those 3 months, you've instituted some things into your lifestyle that you can continue to do beyond that. So you don't have to come back a year later and realize your back is 6.8, right? And
Exactly.
the reality is, though, some people accept it to be what it is and continue doing what they want to do. But the point of this discussion is to let you know it doesn't have to be that, right? You can make changes. They're realistic, real life changes. So let's talk about family, because something that I've noticed is that, especially with the elderly population, the quality of life that they're able to live, especially when dealing with a chronic illness, directly related to the support system that they have. A lot of people don't have children, and so they rely heavily on their nursing aides, their neighbors, a friendly person from church. For those people that do have community, and let's just speak in general to those who have community, because we're going to hope and pray that everyone, God just sends somebody in their life to be a support, right? What can that community do to support a loved one who is dealing with diabetes? And by that, I mean, is it okay? Sometimes it's as simple as a reminder. Did you take your medication today? Setting up an alarm on that person's phone, setting up a pill box with the medication already set out, setting up deliveries from the pharmacy so that they don't forget to refill. And then by the time they're ready to refill, the pharmacy's out and you're missing doses, right? So let's talk about how to support our loved one in the community.
Yeah. I definitely feel like ways you could support it. Sometimes I've had family members show up at the appointments with their family members. So if you have the privilege or the honor of being able to do that or the time, that's really good so that they don't feel alone or they're not afraid. It's new to them. You know, it's not easy rattling that diagnosis and just feeling like, okay, something bad can happen to me. My health can take a toll. So that support physically, if someone is able, that's great. Mentally, that's great as well. So those mental check-ins,
Mhm.
honestly, when you're pushing someone mentally, that also helps them to make better choices for their life as well, knowing that they have someone just there in the background, even if it's just a call once a week, once a month. How's everything? Are you, taking your medication? Are you following up? Everything's okay? Yeah, yeah. And education. I mean, I feel the more someone is educated about something, the risk of them not being compliant or giving up is decreased. I'm not saying that it means it won't happen, but it's decreased, So because some of us are educated about this diabetes and we know how ugly it can get, we're like, no, I don't want this. So, all right, you told me I have what? Okay, I'm working on this. Let's get this weight off. Let's cut out certain habits we're making in our dietary choices. They're more like, okay, I'm willing because I don't want to lose myself to this battle. Um,
Mhm.
so just being there for them, I feel is really important. That mental, that physical support is a way we can help family members or loved ones without
Mhm.
one behind the wheel or
Mhm.
altering the treatment plan.
Mhm. I love that you mentioned going with them to appointments, because one of the challenges that a lot of people have um, is medical illiteracy and not being able to understand. Your physician may not always speak on a level that you understand, especially sometimes even in the hospital when you're being discharged, right? You get all this paperwork. A lot of people don't read that paperwork. Something they don't even, sometimes members aren't able to read, right? So you being a family member that can be a support, be present, to listen, to take notes during an appointment, or to record with the physician's permission, an audio maybe, so you can go home and do some research, ask questions. Again, if you have insurance, a lot of insurances do cover nutritional counseling, and there's a wealth of information online. Our elders are not always internet savvy. So if you're able to do some research for them, okay, what does my grandmother love? She loves her white rice with such and such. Let me see
Hmm.
an alternative recipe I can find online where I can encourage her, or I can buy it and bring it to the house and say, Grandma, let's try this together. Right? My mom's also a nurse, and she always used to say, when you're making changes, don't do it for that person. Do it together. Everybody does it together so that one person's not having barbecue wings and the other person's having cauliflower smothered in buffalo sauce. Like we're all on the same page. So that encouragement is there that we're all making this change and
Agree.
access to what's needed, right? The elderly population has a lower access to finances, right? Their available spending money isn't always there. If you're working and you're able to contribute a little bit something financially to the food that is able to come into the house, you can help them make the right decisions. You can help them, whether it's buy fresh and home cooked instead of buying out. That's a huge help because fast food is so full of sugar, so full of sodium for those with the high blood pressure. Our preserved foods are so full of sodium. And so home cooked meals where you can control what goes in, you can control the sugar content, you can control the quantity. Sometimes it's not that you're eating unhealthy, but you can't stop eating.
That's true.
And so maybe you need to just be a support to that person in the way that they're eating, especially if they're bedbound and their activity, or they're injured or disabled in some capacity, and food is going to be their only way, apart from the medication, of um, changing their lifestyle. And again, one of the side effects, or one of the things you see in the lives of those with diabetes, is this weight gain because the sugar is not going into the cells, therefore it's not being used and it's getting converted into what's known as adipose tissue or fat, right? So it's getting stored in the body. And that's where you'll see this stubborn fat that's just not going anywhere. What the medication does for you is that, especially the oral medication stuff, maybe you can speak more to the injectables or the insulin. But yes, all of that, it increases the pancreas's sensitivity, ability to produce the insulin. And for those who don't have the insulin, it's doing the job, taking that sugar, bringing it into the molecule, into the cells, and allowing it to be converted to be used up. So, the way that you're eating and taking the medication might be your opportunity to get that jolt in your system for your body to be able to start using up that sugar, and you'll see that you lose weight. And another reason why type 2 diabetes is reversible is that for some people is that they've eaten so much, or they have, certain things that they eat are so high in sugar and they've gained this weight over time, living sedentary, not active, not exercising, so that now their pancreas actually can't keep up. It can't make enough insulin to cover the way that you're eating, right? So actually losing weight and gaining control of your appetite will allow you to lose the weight, and then your pancreas has less of a burden, right? They all work together. Another thing I was going to mention, especially with the weight loss, when your blood sugar is high, one of the things you're going to notice when it's uncontrolled is you're constantly hungry, because when you're eating, the nutrients, that sugar is not getting into the cells, so your cells are still like, we're waiting, where's the sugar, where's the food, and it's just floating around in your bloodstream, but it's not getting where it's supposed to get. So you're eating, but you're not getting what you need to get from the food. You're not getting the nutrients and the sugar. So you constantly have this insatiable appetite, and you'll find that you're able to focus. Like your body's systems, a system made up of many systems, right? So even just allowing yourself, like, release the shame of, I gotta take medication. I am married to somebody that doesn't believe in medication ever. Can't believe it when I say take a vitamin for what? And I'm like, well, the food these days is depleted in nutrients. So supplements actually could be a positive thing. It's not the shame of, I'm taking medication, right? And some people, especially in our urban community, we have that mindset of, I ain't taking no medication. I don't trust that stuff. But sometimes, even if it's like you said, Stephanie, talk to your doctor, say, hey, give me 3 months. I'll take this medication for 6 months and I'm going to change up my lifestyle. And you'll find you'll lose that weight. You'll feel better. You'll be alert. You will learn your personal food habits and your personal relationship with food and be able to change it. And then, by God's grace, you won't have to live on that medication anymore, because now you've made those permanent changes that will Allow your body to do what it's made to do. Right? Any questions, again, please put them in the chat and we will hopefully be able to answer them. We're actually in our in our question section. Um, anything that you want to add to the conversation stuff about managing this diabetes?
Um, Really and truly, just having faith, and faith without works is dead. So
Mm,
apply the works. If you got to get a trainer for a while to help you jumpstart it, you do so. If you need to get on some weight loss medication, get evaluated by a healthcare provider that can help you to give you that jump start so that you can lose weight, you can do that as well. But you still have to incorporate necessary lifestyle changes no matter where you go. The issue is 80% diet, 20% exercising. So you have to change up your lifestyle.
mm,
So soda, you want to minimize or cut it out. Excess sugar, junk food, fried foods, you want to limit. I know it's like I can't have my favorite things, but when you get yourself where you need to be and you're stable, eventually you can incorporate it in moderation. Now
mm,
that word moderation,
mhm,
um, too much of it, and find the balance. Because at the end of the day, keep it in mind, your health matters. It matters to the Lord, and it
mm,
matters to you. So take care of it because you only get one body one time. And I believe in my patients not having to be on medications for the rest of their life. So if I see to it that you're actually making progress and you're doing good, not that there's anything wrong with being on meds, but if you are where you need to be and your body's doing what it needs to do, then you're good to go.
mhm, mhm, mhm. And that's what I'm getting from this whole conversation is that there's hope. And hope doesn't mean, like you said, that I'm not on medication for the rest of my life, but it means even if it means that I get in control of my life and I get in control of my habits. And not only that, but now my family, everyone's eating healthier, we're getting into a rhythm. That's a blessing. Sometimes, unfortunately, we live in a world where there's evil, where there is sickness and disease, and by God's grace, one day that won't be the case. But for now, some things, yes, they happen in our lives, but it's not the end, right? There's support out there. There are medical professionals out there that work hard to ensure that you have all the information that you need. And that would be the last thing that I add to this conversation is, we have these things called cell phones. We have computers, we have iPads, and we spend a lot of time scrolling nonsense when there's so much information available to us on how to take care of our bodies. Okay. So that would be my encouragement is like Stephanie said, faith without works is dead. Pray. Ask the Lord for guidance. Ask the Lord to help you to make the right choices, to begin to explore food, explore nutrition, explore the changes you need to make in your life because it's not a one size fits all. And then you have to actually do the work. That is the hardest thing. Identify any barriers, like we discussed earlier in this discussion. Is it finance? Is it access to information? Is it, tiredness? Are you drained? Do you need someone to be an encouragement to you and say, hey, let's schedule these appointments together. Hey, let's go. I'll go with you to these appointments. Hey, let's go to the supermarket. I figured out that brown rice. Let's try arzo rice. Let's try basmati rice. Let's try these different things. Incorporate your relationships into the changes that you want to make because we can't be islands on our own. When we have support, it goes a long way, not just even physically, but spiritually, right? Mentally, and all the changes that we want to make in our lives, in our lifestyle choices, community goes a long way. And if you don't have family, for those who don't have a loved one to do that with them, ask the Lord, guide me to community. Reach out to myself and Stephanie. We're on social media as well. And we can try to connect you with people who, there are so many support groups out there, not just for AA, but there are groups out there for people dealing with chronic illnesses as well. And so getting into community, one of the best things you can do for yourself. And then you will begin to get more information on resources and things that are available to help you. Do we have any questions? We have 6 minutes left. Any questions in the room? If you would like to be a part of our mailing list, and you would like to have further information on how to stay connected and on any upcoming webinars that we have, please put your emails in the chat and Stephanie and I will add you to our email list and you can get further information. And again, I just wanted to promote, thank you, Stephanie, for coming on tonight and speaking to us about this issue. Stephanie focuses on weight loss in her business, Your Health and Wellness, which is also a mental health practitioner. And so if you're interested in those services, please do check her out in Your Health and Wellness on Instagram. And you can find more on my business at maplehealth.org. Steph, if you have a website or any link you want to put in the chat for those who are listening today, you can go right ahead. And that's Made Whole on Instagram and LinkedIn. And thank you so much, everyone, for joining us tonight. Really appreciate you coming out, supporting. This webinar was recorded, and so I'm going to edit and we'll post it on YouTube before the end of the week so that you can go back for those who might have missed the beginning of the discussion as well. Okay, so we'll post clips of this on our social medias and on our YouTube page. We hope that you share this with your loved ones. If you have questions, also feel free to email us, reach out to us as well. Yes, you can book a consult with Steph at the link in the chat, and you can book a consult with Made Whole Health at the website as well. And again, if you'd like to be a part of our newsletter, please put your emails in the group chat and we'll reach out to you. But thank you so much, everyone, for coming in tonight. We really appreciate you doing this. And we look forward to speaking to you again next month. The month of May is, I believe, National Mental Health Month. So we'll be having someone discussing mental health issues.